The dog noticed her first. That was the thing nobody at Ridgecrest Memorial could explain afterward. Not the charge nurse, not the attending physician, not even the security officer who'd been watching the room from the hallway for the better part of 3 hours. The dog, a Belgian Malinois named Ghost, had been sitting rigid at the foot of the hospital bed like a statue carved from muscles and instinct, ears flat, eyes tracking every person who walked within 10 feet of the door. He hadn't made a sound. He hadn't moved. He'd simply watched the way dogs trained for combat watch, not with the lazy curiosity of a family pet, but with the focused, economical attention of something that had learned to read threat before threat announced itself. And then Sergeant First Class Owen Maddox walked through the door, and Ghost did not move. He did not growl. He did not press himself against Owen's leg the way the staff expected. He simply turned his head toward the door, looked at the woman standing there in blue scrubs with a patient chart tucked under her arm, and laid down. Just like that. Flat on the linoleum, chin on his paws, watching her with something that wasn't threat assessment anymore. Owen Maddox noticed. His jaw tightened. He noticed everything. The staff had already learned that about him in the 4 hours since his admission. He noticed when someone's footsteps changed rhythm in the hallway. He noticed when a cart rattled past the door. He noticed the precise angle of the window blinds and had twice adjusted them himself without asking. His intake form listed 3 combat deployments in Afghanistan, 2 in Iraq, a Purple Heart, a TBI from an IED strike outside Kandahar in 2019, and a PTSD diagnosis that the admitting physician had noted in careful clinical language as severe and complex. What the intake form did not capture was the way Owen Maddox looked at people. Not hostility exactly, something older than that. Something that had learned, through years of careful practice, that trust was a liability you couldn't afford in the wrong environment, and that every hospital he'd been placed in since his medical discharge had been, for him, exactly the wrong environment. His left hand rested on Ghost's back before the dog had even finished settling. It was automatic, the way breathing is automatic, the hand finding the fur without the eyes needing to direct it. The woman in the doorway did not look at Owen first. She looked at Ghost. "How long has he been lying down?" she asked. Owen didn't answer immediately. The staff had learned that about him too. He processed questions at his own pace, and if you rushed him, the shutters came down completely. "Just now," he said finally. "He doesn't do that with many people." It wasn't a question. Owen studied her. She was maybe 30, dark-haired, with the kind of steady posture that didn't come from confidence, exactly, but from having been in enough rooms where your posture was the only thing between you and chaos. She held the chart like it was an afterthought. She hadn't introduced herself, hadn't announced her name and role in the bright, practiced way the other nurses did, the way that always made Owen feel like he was being processed rather than spoken to. She was looking at Ghost the way someone looks at a thing they understand. "You know Malinois?" Owen asked. "A little," she said. That was the moment. That was the word, or the absence of a word, maybe. Not the claim of expertise, not the performance of competence, not the eager overcorrection that every other staff member had attempted in the last 4 hours. Just a little. Honest. Specific in its humility. Owen's hand didn't leave Ghost's back, but something in his shoulders shifted, almost imperceptibly, the way a lock turns when the right key finds the cylinder. "I'm Laurel," she said. "I'll be your nurse through the night shift." Laurel Voss had been a nurse at Ridgecrest Memorial for 6 years, and she had been a combat medic with the 82nd Airborne for 4 years before that. She did not advertise this. It was not a thing she led with in introductions or mentioned in staff meetings or embroidered onto her professional identity the way some people do with the most defining chapters of their lives. It was simply something she carried, the way you carry certain injuries, not visibly, not loudly, but in the mechanics of how you move through a room. She had learned in those 4 years what it looked like when someone's nervous system had been rewired by sustained threat. She had sat with men and women in FOBs and field hospitals and the kind of makeshift triage situations that she had promised herself she would never think about after she got out, and she had learned to read the specific language of hypervigilance, the way the eyes never stop moving, the way the body angles itself toward exits, the way silence can be a form of armor. Owen Maddox was wearing all of it. What she had also learned, and this was the thing the staff at Ridgecrest did not understand, The thing that was making the situation in room 14 increasingly combustible was that you could not treat the armor as the problem. The armor was the solution. The armor was what was keeping him functional. The moment you tried to strip it, you didn't get a calmer patient. You got someone in free fall. Ghost was part of the armor, not a pet, not a comfort object in the way the charge nurse, Sandra Kim, had categorized him when she'd called Laurel into the hallway 20 minutes ago. The dog has to go, Sandra had said, not unkindly, but with the particular exhaustion of someone who had been managing an escalating situation for 4 hours and was running low on patience. Policy is policy. The patient has been informed. He's refusing. We're at an impasse. What's his care plan right now? Sandra had looked at her. Stabilization and psychiatric evaluation in the morning. And if he decompensates tonight because we removed the dog is not. Ghost is a certified PTSD service animal, Laurel said. He's registered. I looked it up before I came in. The ADA is pretty clear on this. Sandra had paused. Then, the patient has been verbally aggressive with 2 staff members. Verbally aggressive how? He told Dr. Faro that if anyone tried to remove the dog, they would not enjoy the experience. Laurel had been quiet for a moment. Has anyone asked him what the dog does for him specifically? Medically, functionally, what Ghost actually does? The look on Sandra's face had answered that question. She sat down in the chair near the window, not beside the bed, not in the doorway, not in the aggressive proximity that well-meaning people sometimes adopted with patients they were trying to reach. Just the chair near the window. She opened the chart across her knee like she was going to read it, and then she didn't. She looked out the window instead, at the parking lot below and the scrub of trees at its edge, dark now against a sky that was going the particular shade of blue-black that comes about an hour before genuine night. You were at Ridgecrest before, she said. Not accusatory, just noting. 18 months ago, Owen said. And? A pause. And I checked myself out after 48 hours. They tried to take Ghost then too? He looked at her. You read the chart. I read the chart, she confirmed. But the chart doesn't say what happened. It says you left AMA. It doesn't say what made you decide. He was quiet for a moment. Ghost had not moved. The dog's eyes were open, tracking the room with that same settled, attentive calm that it had displayed since Laurel walked in. Not sleep, not indifference, but a kind of monitoring that had been dialed down from red to something more sustainable. They sent a security guard in, Owen said finally. 2 in the morning. Told me the dog had to go to a boarding facility they'd arranged. Told me it was for everyone's safety. What did you do? I left with Ghost. With Ghost. He paused. Went 8 months before I was willing to try again. Laurel wrote something in the chart. Not the conversation. She wouldn't record the conversation without telling him. She wrote a care note, something clinical and brief, and she was aware of him watching her, do it with the particular attention of someone who had learned that what gets written down has consequences. I'm not going to send anyone in at 2 in the morning, she said. Owen didn't respond. Ghost stays tonight. I'll document the medical necessity. You can tell me what he does, not for my records, just so I understand, or you don't have to. But he's not going anywhere. A long silence. The ventilation system cycled. Somewhere down the hall, a cart rattled past. He wakes me up, Owen said finally. When the nightmares start, before they get bad, before I'm all the way in, he'll put his paw on my chest. Sometimes he just breathes on my face. A pause. Sounds stupid. It doesn't sound stupid. He's pulled me out of 4 episodes in the last 6 months. Without him. Owen stopped. He looked at his hand on the dog's back, and something moved across his face that Laurel recognized. Not grief exactly, but the particular weight of a debt you can't calculate. I had a bad year, he said. I know, Laurel said quietly. He looked at her then, really looked at her, the way he hadn't quite looked at anyone since he'd been admitted. How do you know? It wasn't a question. It was a test. Laurel set the chart on the windowsill. She was quiet for a moment. She hadn't planned to say it. It wasn't a card she played because it wasn't a card. It was just a fact about her life, and she didn't think facts about her life were typically relevant to the patients in her care. But she thought about what Sandra had said in the hallway, about the impasse, about the morning evaluation, about what was going to happen if Owen Maddox arrived at his psychiatric evaluation already at war with the institution that was supposed to help him. Kandahar, 2017, she said. I was a medic with 325. We had a casualty in our unit, sergeant named Torres. Good soldier. Bad year afterward. He had a dog too, actually. Lab mix named something I can't repeat in a hospital. A small thing happened at the corner of her mouth. The VA kept trying to separate them. Every single time. Every single facility. She paused. Torres isn't here anymore. The room was very quiet. Owen looked at her for a long time. Ghost shifted slightly, pressed the crown of his head against Owen's knee. I'm sorry, Owen said. Yeah, Laurel said. Me too. It started at 6:45 the next morning, which was 14 minutes before Laurel's shift was scheduled to end. She was at the nurse's station completing her documentation when Dr. Harlan Farrow came through the unit doors with the particular stride of a man who had been building towards something all night and had finally decided to act on it. He was the attending on Owen's case, 47 years old, board certified in psychiatry, and possessed of the specific kind of confidence that comes from having been right enough times that being wrong has started to feel like a statistical impossibility. He had a security officer behind him, and behind the security officer was a man Laurel didn't recognize, administrative, from his lanyard and his pressed shirt, from the way he held his phone like it was a clipboard. We need to have a conversation, Farrow said. Laurel clicked save on her documentation. About the animal in room 14. She had known this was coming. She had documented everything carefully. Ghost certification number, the ADA statute, the care note she'd written at 11 p.m., and the one she'd written at 3 a.m. when she'd checked on Owen and found him actually asleep, Ghost pressed against his legs, both of them breathing in the slow, even rhythm of something like peace. I documented medical necessity, she said. It's in the chart. You're not a physician. I'm a licensed RN with 6 years of acute care experience and 4 years of combat medicine. I documented an observation. The physician makes the decision. She paused. I'd recommend reviewing the ADA compliance guidelines before making that decision. Farrow's expression shifted, not anger yet, but the precursor to it, the particular look of someone who expected an obstacle to be smaller than it turned out to be. The patient has made threatening statements. He expressed distress at the prospect of losing his service animal. I'd categorize that as, he told me he would make sure I understood what a bad idea it was. Farrow's voice was flat. That qualifies as a threatening statement. I can see why you'd experience it that way, Laurel said carefully. I'd also note that he's a patient with a documented trauma history who was describing the consequences of having his primary medical support removed. There's a difference between threat and desperation. The man with the lanyard, she read it now, Miles Corwin, Patient Relations, spoke up. Monsieur Voss, we appreciate your perspective. But there are liability concerns here there are also liability concerns, Laurel said, in removing a certified ADA-protected service animal from a patient with a documented psychiatric diagnosis and a prior AMA discharge from this facility. A silence. I want to be clear about something, she continued. She kept her voice even. She had learned, in the 82nd, that volume was rarely the most effective tool. Sergeant Maddox has a 4-hour window before his psychiatric evaluation this morning. If he arrives at that evaluation having slept, having been treated with basic dignity, and with his service animal present, you have a real chance at a productive outcome. If he arrives having spent the night fighting the staff who are supposed to be caring for him. She paused. You know how this goes. Farrow stared at her. You have a surprising amount of opinions for a night shift nurse. I have a surprising amount of experience with this specific patient population, she said. Sir. The silence stretched. Corwin's phone buzzed. He glanced at it and then away. It was Sandra who stepped in from behind the nurse's station where she'd been listening for the last 3 minutes. Sandra, who had been doing this for 22 years and who Laurel suspected was operating on about 40 minutes of sleep and a great deal of institutional knowledge. Harlan, she said, with the specific exhaustion of someone who had been standing in this particular intersection before. The chart is documented. The certification is verified. Let it go until after the evaluation. Another silence. Farrow looked at the security officer. The security officer looked at the floor. Corwin was reading something on his phone with the focused attention of a man who has decided to be elsewhere mentally. After the evaluation, Farrow said finally, not agreement, exactly, but not the thing that was going to happen instead. He left. Corwin followed. The security officer looked briefly at Laurel with an expression she couldn't quite read, something between sympathy and relief, and then followed them. Sandra looked at Laurel. "Go check on your patient," she said. Owen was awake when she knocked. He was sitting up in bed, dressed already in the clean clothes someone had brought him. Jeans, a plain gray shirt, the same watch he'd been wearing on admission. Ghost was sitting at attention beside the bed, alert in the particular way he got when he'd heard something that warranted monitoring. The breakfast tray on the rolling table was half eaten, which was more than Laurel had expected. "Heard some activity out there," Owen said. "Morning shift changeover," Laurel said. He looked at her. He had, she'd noticed over the course of the night, a very precise bullshit detector. "Okay," he said, which meant he wasn't going to push. She sat in the chair. Outside, the sky had gone the particular pale gray of early morning in November, the kind of light that makes everything look like it's waiting for permission to begin. "Your evaluation is at 9, I know." "Dr. Farrow is." She stopped. Started again. "Dr. Farrow is good at his job. He doesn't always understand the specific context. Try to give him the chance to get there." Owen was quiet for a moment. "You do that a lot," he asked. "Do what?" "Translate. Between people who don't understand and people who've stopped expecting to be understood." Laurel thought about that. "I think I just noticed the gap," she said. "Someone has to." Ghost moved. He stood up from beside the bed and walked to Laurel's chair and sat down directly in front of her, which was, she'd been with this dog for less than 12 hours and even she could feel this. Unusual. He looked at her with the particular attention he reserved for people he had decided were not threats. Owen watched him. His jaw worked. "He doesn't sit in front of people," he said. "He sites beside me. He monitors. He doesn't." He stopped. "I don't know what he's doing." Laurel looked at Ghost. Ghost looked at her. She put her hand out, palm down, the way you offer your hand to a dog you don't want to startle, and Ghost put his nose against her knuckles. "I think he's saying thank you," she said. Owen looked at the window. The muscle in his jaw was doing something complicated. "He's not supposed to do that," he said, and it came out rougher than he probably intended. Laurel didn't say anything. She had learned, in the field and in 6 years of acute care, that some moments were not improved by words. The psychiatric evaluation lasted 2 hours and 40 minutes. Laurel was off shift by then, had been off shift for almost 3 hours, but she had not left the hospital. She had gone to the break room and gotten coffee and sat in the chair in the corner and done the particular kind of waiting that is not really waiting, but something closer to standing guard. Sandra had seen her there at 8:30 and said nothing, which was its own kind of permission. At 11:47, her phone buzzed. It was Sandra. "He's staying." Voluntary admission. 3 to 5 days. Evaluation went well. Laurel set her phone down. She drank the cold coffee. "Ghost is approved for full stay per Dr. Farrow. He's going to need the paperwork, but..." There was no period at the end of that sentence, which meant Sandra was in the middle of something. Laurel put the phone in her pocket. She thought about Torres. She thought about the lab mix with the names she couldn't repeat in a hospital. She thought about the particular arithmetic of these situations, the ones that went sideways and the ones that didn't, and how rarely the difference came down to anything dramatic or systematic or institutional. How often it came down to one person deciding to stand in a gap. She was in the break room putting on her jacket when she heard footsteps in the hallway, deliberate and even, and looked up to find Owen Maddox standing in the doorway with Ghost at his heel. He looked different than he had 8 hours ago, still guarded. That wasn't going to change, not in 8 hours, possibly not in 8 months, but something had shifted in the architecture of it. Like a structure that had been holding against pressure for so long that it had forgotten what it felt like to not be braced, and had just now, very slightly, remembered. "Sandra said you were in here," he said. "I was just leaving." He was quiet for a moment. Ghost sat down beside him. "You didn't have to stay," Owen said. "I know. You were off hours ago. I know." He looked at her with that precise, careful attention she'd been on the receiving end of for most of the night. "Why?" Laurel picked up her bag. She thought about the right answer, and then she thought about the fact that Owen Maddox had a detector for anything that wasn't the real answer, so there was only one thing to say. "Because Torres didn't have anyone standing in the gap," she said, "and I've been thinking about that for a long time." Owen was quiet. Ghost pressed against his leg. "I'm going to give you my number," she said. "Not as your nurse, My shift's over, and you've got great day staff. Just, if you hit a wall in there, if they try something that doesn't make sense to you and you need someone to translate." She paused. "You don't have to use it." She wrote it on a piece of paper from the break room's notepad, the pad that said Ridgecrest Memorial. "Together we heal," across the top in the particular shade of blue that hospitals use to suggest wellness, and held it out. Owen looked at the paper. He looked at her. Ghost stood up. He took the paper. "Laurel Voss," he said. It was the first time he'd used her name, Sergeant Maddox. Something that might, in different light, have been called the beginning of a smile. "Owen," he said. "Owen," she agreed. She walked out of the break room and down the hallway, and through the double doors into the November morning, where the light had finally finished deciding what it was going to be, and had settled on something clean and cold and specific. She stood in the parking lot for a moment, with her keys in her hand. She thought about Torres. She thought about the lab mix. She thought about the 4 combat deployments listed on an intake form, and the 2 a.m. hour, and a dog laying his head on a man's chest in the dark to tell him he was still here, still here, still here. She thought about the fact that the gap was always there, in every unit, every ward, every intake desk and evaluation room and hallway conversation. That the system was built with the best intentions and the worst blind spots. That no policy fixed the gap. That no committee addressed it. That it was always, in the end, one person who had to decide to stand in it. She got in her car. She had 4 hours before she had to be back at Ridgecrest for the start of her next shift. She drove home through the November morning, and she did not think about the conversation with Faro, or the way Corwin had looked at his phone, or the security officer who had looked at the floor. She thought about Ghost putting his nose against her knuckles. She thought about Owen saying thank you without saying it at all. She had been doing this job for 6 years. Before that, she had done a different version of it, in places where the stakes were higher, and the margin for error was smaller, and the thing you were fighting to protect was more immediate and obvious. But she had come to believe, over these 6 years at Ridgecrest, that the stakes here were not actually lower. That the people coming through the doors of a psychiatric unit, especially the ones who came in guarded, who came in armed with silence and distance and dogs, who stayed at attention because that was what they'd been trained for, that these people were fighting just as hard as anyone she'd ever triaged in a field hospital, that the battlefield was just less visible. That was the thing about the gap. You had to be able to see it before you could stand in it. She pulled into her driveway. She sat there for a moment with the engine running. Her phone buzzed, a number she didn't recognize. "This is Owen Maddox. Ghost wanted me to tell you he's taken your chair in room 14. She read it twice. She thought about the dog choosing her chair with the deliberate, unperformable logic of an animal who understood something about trust that most humans spend a lifetime working toward. She turned off the engine. "Tell him it's his," she wrote back. "He's earned it." She went inside, and she slept for 4 hours, and when she woke up and drove back through the November morning to Ridgecrest Memorial, she felt something she had not felt in a long time. Not hope exactly, not the simple, uncomplicated thing that word usually means. Something more durable than that. Something that had been tested against the specific conditions of the world and had held. She badged through the staff entrance, changed into her scrubs, and walked up to the 3rd floor. She passed room 14. The door was open. She didn't stop, but she glanced in. Ghost was in the chair by the window. Owen was asleep. She kept walking.